The United Leukodystrophy Foundation presents Refsum disease, presented by Christys DeMarco with the Global DARE Foundation and Dr. Florian Eichler with Massachusetts General Hospital.
Thank you, Keely. Welcome, everyone. Thank you for joining today's presentation on Refsum disease. My name is Christys DeMarco, and I'm the president and founder of Global DARE Foundation. I'm also a new ULF board member. I'm honored to be presenting today alongside Dr. Eichler, the associate professor of neurology at Mass General Hospital and Harvard Medical School. If you could go to the next page, Keely. And actually flip to the next page. So let's review the agenda for today's session. Florian will kick off our discussion today with a high-level overview of Refsum disease. Then I'll review my Refsum journey and review Global DARE Foundation's mission and advocacy plan. Then I'll hand it back over to Florian, who will review our medical and scientific advisory board and their objectives to help us improve the quality of life of Refsum patients. Now let me pass it over to Florian, who will start our presentation. Go up to the next page, Keely. Thank you.
Great. Thanks so much, Kristie, and thanks to the ULF for putting on this webinar. I couldn't think of a better advocate to work with as Kristie. She's really been instrumental in bringing together the Refsum community and putting a lot of these initiatives we're talking about together. I will just provide a high-level overview of what Refsum's disease is and take you through some of the thinking around how the disease comes about and what symptoms occur, and also what treatments and gaps in knowledge exist. So adult Refsum's disease is a metabolic disorder caused by a few faulty genes that are important for the breakdown of phytanic acid. The main enzyme here is fentanyl-CoA hydroxylase, a long word for an enzyme essential to breaking down this fatty acid. And this phytanic acid is not produced in the body, but found in many foods, and hence it's tantamount to understand what concentrations of phytanic acid exist across different kinds of foods. And it turns out that phytanic acid is mostly in fatty tissues and secreted in milk and milk products. So patients with Refsum's disease are at danger for having high phytanic acid levels if they take in dairy products, beef, lamb, some fish, but there might be other foods that are high in phytanic acid and that are currently investigated. In Refsum's disease, phytanic acid accumulates in nerve, liver, and fatty tissues, and Refsum's disease, importantly, can be life-threatening if undiagnosed, and there are ways to avoid the buildup of phytanic acid, and hence early diagnosis is tantamount. Next slide, please. So just for those of you who are interested in some of the science behind Refsum's disease, a quick overview. Refsum's disease is a peroxisomal disorder. The peroxisome is a small organelle inside the cell that's responsible for breaking down certain kinds of fatty acids, such as very long chain fatty acids, and also phytanic acid. So this enzyme I mentioned earlier is located within this peroxisome. It is an autosomal recessive disorder. That means you really have to have two copies of this gene affected in order for this to manifest. It leads to a complete loss of the function of this gene. A nice opportunity, as you will hear, for gene therapy. It's a very rare disorder. as mentioned in the prevalence here. Most of the defects in Refsum disease are due to genetic defect in this fentanyl-CoA hydroxylase, but there are some cases, about 5%, that are due to defects in other genes that control peroxisome biogenesis, such as what is caused by RCDP. And the problem here is that the enzyme that breaks down phytanic acid does not even get to the proper localization in the peroxisome, and it sits outside of the peroxisome, therefore does not function well. And then there are a few other causes for buildup of phytanic acid, usually due to buildup of shorter fatty acids that then build up and have repercussions for phytanic acid. Next slide. So there are a variety of symptoms that are caused by buildup of phytanic acid, and this ranges from the eye being affected to various parts of the nervous system, peripheral nerves being affected, the brain being affected, but also skin. You can see itchy, scaly skin, and weakness occurred due to buildup of phytanic acid in Refsum's disease. Next slide, please. So I thought I would present briefly what is known about the disease course in Refsum's disease, and this is largely work pioneered by Tony Wierzbicki in London, and shows you here that most patients with Refsum's disease are fine until about 10 years of age. And then many of them start to have some difficulties with vision, particularly at night, and develop some night blindness while color vision is preserved. Patients often will also complain of difficulties with smell and taste. You can see that over time, there are also problems that are affecting the nerves. Peroxisomes are very important for the particular longest tracts of nerves in the body that run down through the spinal cord and also into the peripheral nerves. So you often see weakness and changes in sensation and numbness occurring. Some patients will develop some hearing problems, not everyone, but a few do. And you'll see others who have coordination problems and skin manifestations that often respond very well to dietary intervention. So once you reduce phytanic acid in diet, those skin changes rapidly respond and that itchy, scaly skin goes away. Next slide. So just here some examples of clinical features that might tip off a clinician to the diagnosis of Refsum's disease. I think most distinct is the retinopathy. You can see when you look at the eye grounds of these patients, the complaint, as I said before, is that of tunnel vision. The center of the eye is where color vision exists, and so that is often preserved, but it's often that night blindness that patients complain of. And constellation typical for Refsum's disease is that beyond the eye being affected, there are also some bony abnormalities that are often seen. And that is quite typical for Refsum's disease. You don't see a retinopathy associated with bony abnormalities and that many disorders, and Refsum's disease can therefore be diagnosed clinically if you pay attention to a shortening of the extremities. It's the fourth and fifth toe that's shown here, but also in the fingers, you can see this shortening. There's some other bony abnormalities that we're also still trying to understand, and that might be contributing to nerve compression and pain. So a lot still to be explored. Next slide, please. Okay, so what are the current treatments? As I mentioned before, it's tantamount to adhere to a low phytanic acid diet. This means removing foods that are high in phytanic acids, such as dairy products, beef, lamb, and some fish. We understand that there are also some other vegetables that might be high in phytanic acids, such as green peppers or peanuts. And so that is currently still being investigated. We know that the phytanic acid restriction can help improve skin, as I mentioned before, but people have also reported that their weakness and their sensory neuropathy can improve, and it can slow progression of vision and hearing loss. What else can be done to lower phytanic acid levels? Plasmapheresis, lipid apheresis is being conducted, but we really reserve that only for acute management in extreme situations in the hospital. So if you have acute heart arrhythmias due to refsums or extreme weakness, that might be the modality to use in an acute crisis situation. It's not something we do on a chronic, regular basis. Beyond this, symptom management includes cataract surgery, eye drops, hearing aids, cochlear implants, and other modalities. Next slide, please. So I'm going to now turn over to Kristie, who has lived through Refsum's disease and has so much more of a compelling story to tell than I do.
Thanks, Florian, for your overview of Refsum. I think you did a great job at covering a lot of the high points around the disease. Now I'll talk a little bit about my Refsum journey that I've been on for just a little bit over a year. Time flies. So I'm going to go back a little bit. In 2010, I had started a wellness plan. I had gained some weight from having 4 children and needed to get a little bit healthier. So I started a nutrition plan, started eating healthier, exercising, and it was pretty successful. Over the course of 6 years, I lost 75 pounds. I became an Ironman level triathlete. So I was really in pretty good health at that point in time. I had some minor hip pain. I had some migraine headaches. So I'm always looking at improving, and how do I, get myself into the best physical shape. So I did try, migraine headaches obviously can be debilitating in themselves. So in 2017, I tried to attempt, I'm not a medicine person, obviously sometimes can frustrate my doctors, but I don't like medicine, so I try to avoid it as much as possible. And I was trying to find a holistic way to resolve my migraines. So I was trying a couple different nutrition plans, and one nutrition plan that looked promising was a low carbohydrate diet. And I did start that diet, and it did resolve my migraines. So I was very excited about that, very kind of life-changing. But little did I know that new nutrition plan would really supercharge a rare disease that had been rather dormant my entire life. After changing my nutrition plan within 2 or 3 months of that, in hindsight, now that I look back, I started to have increasing left leg pain and neuropathy. It eventually stopped me from being able to ride and run. So, this triathlete who was, probably working out, 10, 12 hours a week could no longer do those things, right? And then shortly after that, I started to lose my peripheral vision, which was scary in itself, beyond the leg pain and neuropathy. I was caring less about not being able to ride or run. Losing my vision was not something I wanted to think about. So, between 2017 and 2019, I saw 15 different specialists, and countless diagnostic tests and even one nerve surgery, hoping to resolve some of my left leg pain. I even was suspected of having MS at one point, but that was not accurate. Actually, 2017 was the last year, I didn't know it at the time, but it was the last year I would race. I was just gradually losing everything I love to do. And I still had no answers at that point. I just knew something was wrong with me, and I wasn't going to give up until I found out what it was. I just kept pushing and pushing. In March of 2019, I was diagnosed with inherited retinal dystrophy, which seemed odd to me because no one in my family had a retinal dystrophy. How could it be inherited? But it did provide a diagnosis for the peripheral vision loss. I still didn't really rather believe it at the time, but who wants to believe that they're going to lose their vision? I certainly did not want to. It also didn't answer any of the other questions around the other symptoms I was experiencing. They did recommend, though, which I am so glad they did, that because I have 4 children, to see if they would also be impacted, to do a genetic test. And I received that genetic test back, and it just connected all the dots. The genetic test told me that I had Refsum disease. It even connected something I've had my entire life, which was that shortened 4th toe that you saw on the slide that Florian provided. I've had one on my left foot for my entire life, so it just connected everything. And so it was exciting to have a diagnosis. And what I really learned during that time is that you really have to trust in yourself, really believe that and push for a diagnosis. Often I would think to myself, am I just thinking it all up? Am I just imagining these things? And so I just trusted that I knew what I was talking about and knew myself. You would think, after you had a diagnosis, that your doctors would know exactly what to do and have a treatment plan ready for you. However, what I learned really quickly was that in rare disease, that's really not the case. You find yourself becoming the expert and educating many on the disease. I was very lucky early this year to actually, be referred over to Florian from the ULF. He's just an awesome doctor. He's willing to learn. He'll be perfectly honest. He doesn't have all the answers, but he's also very interested in learning, and being willing to manage my care and end to end for this disease, which is a big step forward. Because I struggled in the beginning to find the right path. So I was also incredibly lucky in this journey to connect with a great group of patients through a private Facebook group. I just learned everything from them. I learned everything about the diet, some of the challenges with living with the disease. Many of them had the disease for a long period of time, so they had a lot of experience. What I learned really quickly was that, even with really good compliance with the diet, which I was really good about complying with diets, right? So I thought, hey, go on a diet, I'll be all good, right? I can slow my vision loss, I can prevent these other symptoms. But what I learned really quickly was that even with good compliance with the diet, people still had significant vision loss, would have hearing loss and mobility challenges. As I learned more, I really learned it was a forgotten disease. There had been such great research done in the past to understand the disease, and establish the current treatment therapies. However, there wasn't anyone actively researching for a cure or better therapies. After everything I learned, I decided I really wanted to take action. I wanted to change my potential future. I didn't want to lose my vision. How do I prevent that? How do I prevent getting hearing loss as well? And how do I get back to the things I love to do? Because I still can't race in triathlons or even do any of some of the activities I used to do. And I want to make a positive impact for the rest of the Refsum community. They're like my new family. Many who I've met, I think I'll know for the rest of my life. So, this led me to start Global DARE Foundation. You know, in this journey, I've connected with so many great, helpful patient organizations along the way who've really helped me just really kick Global DARE Foundation off the ground quickly. I mean, we've only been up and running for less than 8 months. You know, ULF has been a tremendous help in that, as well as a couple other organizations I'd like to mention. Global Genes and NORD are really some great umbrella organizations that have been very helpful in helping kickstart our work. I'm also very thankful, as I was saying earlier, to be referred over to Florian. I think, like I said, he's one of the first doctors who's really took an interest in learning more about the disease. Also, he volunteered, I think, in my first appointment with him. As we got talking and his interest in the disease, I asked him if he would be the chair of our medical and scientific advisory board. And, you know, you would think he'd be like, oh, let me go back and think about that. But he was right on it. He was like, yeah, I'll do it. And I think we just hit it off from the beginning. So, so Kayla, if you could move to the next slide, that would be great. So Global DARE Foundation, you know, we have a very clear mission. You know, we got kicked off in October 2019. DARE stands for Defeat Adult Refsum Everywhere. Our mission is to provide worldwide awareness and better quality of life for all who are diagnosed with adult Refsum disease. You know, our goal is to support research, education initiatives, awareness campaigns, advocacy. Driving research will be at the center of what we do, because we really dare to believe that there's a cure for this disease. Next slide, Keely. So we've got our board of directors. We're a small but mighty team. We're highly motivated. All of us are part of the Refsum community, and we're really motivated to find better therapies and ultimately a cure. 3 of us are Refsum patients, and we've got a couple of our family members on the board. We're actively engaged on a day-to-day basis, moving forward our objectives and driving forward our mission. I'm really proud of what this team has been able to drive to date. All right, if you could flip to the next page. All right, so we've accomplished a lot to date. We've only been operational for 8 months. You know, I'm just immensely proud of what we've been able to do. We launched the foundation in October of 2019, and we had our first board meeting. I can tell you, I've never run a foundation before. So, you know, being part of the ULF board right when I got Global DARE Foundation started was incredibly helpful. You know, being part of a mature, seasoned organization that really knows this space made a tremendous difference in helping me get Global DARE Foundation off the ground. You know, shortly after getting our first board meeting, we received our 501(c)(3) approval in November and kicked off our first fundraiser. We had a lot of fun in our first fundraiser. We did a fundraiser that was across the whole community. We rolled out a wellness challenge in January, 6-week wellness challenge. And it was a fun way to bring the team together and raise funds at the same time. In that first fundraiser, we were able to raise $10,000. In January, we established the Medical and Scientific Advisory Board. I won't steal Florian's thunder, but he'll present a little bit later on the board and their objectives. But I'd personally like to say how excited I am about this board. They are just so engaged and active with us. I believe this board will really help make a real difference in the quality of life of Refsum patients. And then during Rare Disease Week, we kicked off our second fundraiser, and we were able to raise just enough money to start our first research project in March of 2020. I think Florian touched a little bit on this, but this research project will, you know, have a direct impact on the quality of life of Refsum patients. We're going to be testing the botanic acid content in foods. To date, there's only been 151 foods published with their photanic acid content. Just think about that. And the vast amount of foods that we have in today's world, and have only 151 foods with published photanic acid content. So we want to change that. We want to be able to get more info into Refsum patients' hands so that they know, what food that they can eat safely. Hopefully, I'm hoping it opens up some more foods. There's definitely some foods I'm very interested in seeing what their photanic acid content are. Things that, as an example, nuts have been tested, but only a couple nuts have been tested, and there are higher levels in photanic acid levels. So I avoid all nuts, but maybe we don't have to avoid all nuts, and I think doing that testing will make a big difference. And I think we envision, having that as a yearly project, right? With our funding, we'll only be able to hit so many foods, right? And so each year we'd really like to go after more, and really grow that database of foods with its photanic acid content over time. In May, was a little disappointed. We were supposed to have a conference in London in May 2020, but obviously due to the COVID challenges, we had to cancel that conference. But we decided to break apart that agenda and launch a webinar series. We just kicked that off this month and had our first webinar a couple weeks ago. And I'll touch a little bit more on that webinar series at the end of this presentation so you can know what's coming and what you can attend. Very excited. In July, we are rolling out the first ever patient registry on Refsum's disease. This patient registry is sponsored by Sanford Cords. This will be just a great resource for us to better understand the disease, help understand where we can drive research initiatives, and provide guidance on areas where patients need more support. Another particularly important purpose is to quantify the Refsum populations. Numbers matter. Investors, others really want to know the numbers, right? It is a profit business out there as well, and we have to understand that, right? You're more likely to get buy-in from investors on therapies. We're trying to work through the idea of gene therapy for Refsum's disease, and to get someone to buy into that, we need to understand the population, and having this registry get started, I think, will help us move that forward. Next slide, Kaylee. So I'm a firm believer in establishing a clear plan, right? So Global DARE Foundation has a clear plan. We set up our objectives. We've got these objectives listed out on our website. I like to, make sure we've got full transparency on what we're working on in Global DARE Foundation. We've set up these pillars into 3 areas: research and care, raising awareness, and collaboration. As you heard from the prior slide, we've accomplished a lot towards these objectives in 2020, but we're not near done, right? We've got a lot more to go, and we'll set another set of objectives for 2021. We'll continue to plug along and move forward on our mission. So I'm going to touch a little bit on each of these pillars and highlight some areas that will be of interest. So I'm not going to cover a lot on research and care because you're going to hear a good amount about those things from Florian in his presentation of our medical and scientific advisory board objectives. We've made many of these objectives, we've made a good amount of progress on to date. I've talked about a few of them already. And this is a strong area for us to be focused in on. And like I said, I think our medical and scientific advisory board, I can't echo how excited I am about them and their ability to help us move forward our mission. So raising awareness. On raising awareness, one of the big things I want to point out is that we need to find more patients. Finding more patients is so critical to move forward our mission from a couple different perspectives. Finding more patients and engaging with them allows us to provide them more support. I learned a ton from connecting with the Facebook group, right? I had a community that I could work with and that I could I could understand my challenges and my concerns and help me answer my questions. We as Refsum patient becomes the experts, right? Because we live it on a day-to-day basis. And so by connecting with more people who are already diagnosed with the disease, I think, we're stronger together, right? And the other thing is to get people diagnosed earlier. Often patients with Refsum disease receive their retinitis pigmentosa diagnosis well before Refsum. So that's such a shame, because Refsum disease is one of the few causes of retinitis pigmentosa that have a therapy associated with it. Vision loss, hearing loss can actually be slowed by the diet. And obviously you heard earlier, other symptoms can be or lessened. So I think it's so critical that we get an earlier diagnosis. The last pillar there is collaboration. One thing I've learned from my professional career is that collaboration is key to success. Bringing together patients, clinicians, researchers into a collaborative network will be a key driver in helping us achieve our mission. Collaboration with other rare disease patient advocacy groups is so critical as well. We're all doing the same things. Working together, leveraging one another's expertise will help us drive forward faster. This is one of the key reasons I became a board member at the United Leukodystrophy Foundation. As I mentioned earlier, the ULF is an experienced organization who understands this rare disease space and is well respected. In my time as a board member, I've learned so much in a very short period of time. It really helped, as I mentioned earlier, to jumpstart Global DARE Foundation. I know our collaboration with ULF will help us drive forward better therapies faster. I think that's I'm completed on this slide, and move on to the next slide. And I'm going to pass it back over to Florian to review our medical and scientific advisory board and their objectives.
Sure, thanks, Kristie. And just to echo the what Kristie said, I couldn't think of a better venue as the ULF to launch a foundation from, and this is very much what I had hoped the ULF could promote in its next generation effort, where mentoring of new foundations such as the DARE Foundation is, I think, really low-hanging fruit. So Kristie has really been doing the heavy lifting on this entire operation, and I cannot really take any credit here. She single-handedly reached out to many people in the community who had for many years been working on Refsum's disease and understood Refsum's disease either from a clinical point of view or biochemical point of view. We have really giants like Ron Wanders from Amsterdam and Joe Hasia, who think very deeply about peroxisome biology. People from like Tony Rubitsky, who's in London been working on Refsum's disease for 40 years. Many dietitians, people who are really peroxisome experts like Nancy Braverman, and many others shown here, to speak to the point that it really takes a village when you are dealing with a rare disease that affects multiple different organ systems. Bart Leroy, being an ophthalmology expert, is bringing as much insight into this as some of our biochemistry colleagues. But you need to tackle a disease like this from multiple different angles and from multiple different points of view. And so the idea of collaborating is a no-brainer. It's something that really empowers everybody and can drive progress forward. And Kristie very nicely outlined the principles and the pillars of how this should happen. But first and foremost, it's really about the patient perspective and the unmet need that patients are experiencing. and trying to leverage our knowledge of biology to address those needs. And here really everybody from dietitians to basic scientists and clinicians are needed. Next slide. So just to briefly outline the medical and research objectives that Kristie nicely set the stage for, we really think here across three pillars. One in treatment and care. We know what the gene defect is. We understand the enzymatic problem, but the question really is, how does this translate into a broader management of symptoms over a lifetime? And how do you go about establishing guidelines not only for dietary intake, but also for treatment and management of these many different organs, from eye to brain to peripheral nervous system to skin, and how can that be done in a way that brings together all knowledge in a rare disease? Clearly, we have to work together across the entire globe to make that happen. And so what we've first identified as low-hanging fruit, as Kristie mentioned, is measuring actual phytol levels within certain foods. I mentioned early on that it's the buildup of this phytol that is critical. It turns out that phytanic acid results from this phytol accumulation, and phytol itself is a product of chlorophyll reprocessing as it occurs during rumination in cattle and other animals. And this is then secreted into milk and found in different meats. But what about other foods? And here now there is a whole push to measure phytol levels in different vegetables and to give better guidance to the next generation of patients affected by Refsum's disease. As Kristie also mentioned, it goes far beyond diet. How do we advise patients on what level of activity or what level of fasting is safe if the problem is that you are releasing fatty acids from those fat stores and a fasting state is dangerous? What level of exercise, what kinds of procedures, what kinds of surgery can a patient go through? What advice should be given during anesthesia? And so some things we know, but many other things I think need to still be collated and shared across the community. In research, we have initially focused on thinking about the next generation of therapies, such as the opportunities that come with gene therapy. Here there are some obvious targets in the eye, but also in the liver, where we know that phytanic acid accumulation can be controlled if properly targeted in liver. And we have some wonderful collaborators and experts across different centers that are also giving webinars and on this topic. So I think, again, a nice time to remind people of an almost forgotten disease like Refsum's and bring it smack front into the center of attention by applying some of the cutting-edge new technologies and treatments. The third pillar of collaboration is clearly tantamount to any of this happening. And if we don't know how to put the patient's plight front and center, understand what's clinically meaningful, what's desired by a patient, what's needed for them to lead a fulfilled life free of suffering, then we're not doing our job. And so I think the medical community and the people that Kristie has so nicely assembled really share that awareness and are doing their best to, on multiple levels, address the pillars of treatment, care, research, and collaboration. So I think I will now turn back over to Kristie.
Yes, thanks, Florian. And thanks for being our chair of our Medical and Scientific Advisory Board and taking on that challenge. You know, I know it's a brand new thing and you've got a full plate as it is, so I'm really appreciative on that and your participation today as well. So if you want to flip to the next slide, Keely, I'd like to just briefly cover for the audience our Refsum webinar series. So we've got 3 more webinars scheduled for the summer. The next one is next Wednesday, and it's a little bit deeper dive into the science behind Refsum. So it might get a little bit more technical than today's presentation. You might learn a little bit about mouse models and how those are used in research. And that'll be done by Ron Wanders and Satya Ferdanusa from the University Medical Center in Amsterdam. And then on July 24th, we're going to take a deep dive into our favorite Refsum diet. And we should have actually updated diet guidelines that are going to be published. And those will be reviewed by Eleanor Baldwin and Sarah Furman. And that will actually be a 90-minute session. And they're at the Guy's and St. Thomas Hospital in London, where the Refsum clinic is. They have the largest cohort of patients with Refsum disease. So, and finally, Florian talked a little bit about this around the prospect of gene therapy as a potential future therapy for Refsum disease. We've just, started some of those conversations at the beginning stages, but we thought it'd be good to provide a view into that for patients and the Refsum community as a whole. So we'll be having that webinar on August 7th, and it'll be done by Ryan Butler from UT Southwestern. Registration is available on our Global DARE Foundation website, and that can be accessed by just typing in Global DARE Foundation on Google, and you can find us. If you want to flip to the next page, folks can also see our website there. So now I'd like to open it up for questions. I think we've got a few questions so far. So I think Keely's going to be our moderator.
Yes. So the first question is, how did Global Genes and NORD help you get started with your foundation?
So so Global Genes was probably, ULF was the actual first, actually maybe NORD was the first organization that I reached out to, and they connected me to ULF. So I think NORD's got a great set of resources that, know globally, more of an umbrella organization across all rare diseases, and they had a lot of great information about, lots of great webinars on patient registries. I'm a data person, so, understanding how important data is to drive forward research. I was asking them tons of questions around, well, how do you get a patient registry started? Well, you have to have a foundation. Okay. And here's the next step and the next step. And then obviously I connected with ULF and had lots of good conversations with Keely and Bob. And then Global Genes was great. I went to their patient summit in September of last year, and that was just an amazing experience. I connected with so many other rare disease patient advocacy groups at that summit. As I said earlier, we're all doing the same thing. So, I had my list of questions of I don't know this space at all. And, how do I actually get things started and running? And I left that conference with a laundry list of things to do. So that was September. By October, we had our first board meeting, and by November, we had our IRS approval. So, between those 3 organizations, I had learned so much that it really helped get us off the ground quickly, and we've accomplished a lot in a very short period of time. So, all right.
Great. And then a follow-up question of how can someone access the webinars that you had mentioned previously and the patients registry?
Yeah, so the webinars are from our website. You can go to our website, and there's a place called DARE videos. And I can access it from our homepage, and it'll provide the recorded videos. We've only had one of the webinars so far, but every single webinar that we do, we'll have it recorded. We'll have a link to this one as well on our website. The patient registry has not kicked off yet. It will kick off probably mid-July, and we'll have access to that webinar on that patient registry from our website as well. But it's not out there yet, so soon to come.
We do have Dr. Michael Gelb was asking about wanting to hear more about the measurement of phytanic acid in foods. If we could bring Dr. Eichler on. Okay. Dr. Gelb just wants to let you know that he can be contacted later, so I can connect the two of you to further discuss phytanic acids.
Yeah. And I'll freely admit that I'm not the expert in phytanic acid measurement, but Ann Moser and Ron Wanders are all part of this effort. And I'm sure Mike, you know Ann and others, so they would be glad to talk to you. But what I understand from Ann and Ron is that it is much easier to measure phytol levels themselves rather than phytanic acid. And so they are going about measuring phytol and establishing standards around that. And there are clearly relationships that they can interrogate there. I don't know, Kristie, if you wanted to say more.
Yeah, so we have a working group that has been put together for that. So we'd be happy to have Michael engaged in that working group and certainly connect. And I can, we can get his, I can see his email address down there, but quite can't type it out right now. But get that from Keely later, and we'll get you connected into that working group. We're happy to leverage whatever resources we can. We obviously have only so much money too. So the more bandwidth we have places, that will be very helpful. So.
Great. It doesn't look like we have any other questions coming in. So if either of you have any final thoughts to pass on to our viewers.
Yeah, so in closing, I just wanted to thank, Florian for presenting alongside me. It's been great having him at my side, and I look forward to his continued work with us. And then thank you to everyone that participated in today's presentation, and thank you to the ULF for putting this on. It's, as I said, I can't say enough great things about ULF. And that it just, concludes today's webinar, and thank you.
Wonderful. Thank you so much for everyone that has joined us on the Refsum disease presentation. And we hope to see everyone next year in Chicago.
Great. Thank you, Kaylee.
Thanks, Kaylee. Thanks, Kristie.